Cervical cancer is a major cause of mortality among the women globally, primarily arising from the transformation zone of the cervix. The vast majority of the cases are squamous cell carcinomas, driven by persistent infection with high-risk human papillomavirus. The core mechanism involves high-risk HPV serotypes like 16, 18, 31 and 32, inducing the cellular dysplasia, termed cervical intraepithelial neoplasia. This process progressed from CIN1 mild to CIN3 severe carcinoma in situ before breaching into the basement membrane to become invasive cancer. The PYT pointers HPV type 16 and 18 accounts over 75% of the cases. The clinical hallmark often presents as postcoital bleeding or intermenstrual bleeding. The risk factors: early age of first intercourse, multiple sexual partners, lack of screening. Associated symptoms like the patient with Lynch syndrome have a significantly higher risk of related gynecological malignancies such as endometrial cancer. Vaccination now offered to both boys and girls, typically aged 12 to 13, to reduce the incidence of cervical, anal and oropharyngeal cancer. CIN management: large loop excision of the transformation zone or cold coagulation. The gold standards: the screening investigation, cytopathology, the pap smear, targeting the transformation zone is the traditional standard, though HPV DNA testing is increasingly becoming the preferred primary scheme. Investigation of choice in a view of diagnosis: colonoscopy guided biopsy of any suspicious cytology or visual abnormality. Staged according to FIGO systems. Advanced disease typically requires radiotherapy or synchronous chemoradiotherapy. The examiner's twist: the age trap. In UK, screening starts at the age of 25. However, NB often tests the HPV vaccination age, which is much earlier, 12 to 13 years, to be effective before sexual debut. The cytology versus HPV. NB may ask for the most sensitive screening tool. The answer is shifting towards the HPV DNA testing, as newer methods are replacing the traditional cytology. The Lynch distractor. While Lynch syndrome is famous for colorectal cancers, remember it is the most common cause of hereditary endometrial cancer, which often presents similarly with abnormal bleeding. As a one-liner, cervical cancer is a preventable HPV-driven malignancy, which is type 16 and 18, primarily screened by pap smear or HPV testing, definitely diagnosed via colonoscopy guided biopsy. NEET PG strategic advice: focus on molecular shift. Current standards are moving away from the cytology first screening towards the primary HPV testing. Ensure you are familiar with the Millen system for the other head and neck cancers. But for the cervix, focus on the Bethesda classification for reporting pap smears. Additionally, the inclusion of the boys in the HPV vaccination program is a high-yield recent update fact likely to be tested.